Good morning, madam.
Good morning, Dr. Samir.
Good
Good
morning,
morning.
madam. How are
Good
you?
morning, Mita.
Good, thank you. Good morning. Yeah, so we are waiting for your talk.
Oh, okay.
Yeah. Good morning, sir. Dr.
Good
Jagdish
morning.
Bhai. Morning, sir.
So I'll be talking on very basics of insulin resistance, and I'll try and simplify things for the people to understand it in its simplest of the forms, so that they can make some practical changes in life.
Correct.
Hi,
Yeah.
Kairavi.
Good morning.
Good morning.
Good morning.
Welcome, Shaw.
Good morning.
Morning, Satish Bhai.
Good morning. Good morning.
Yeah.
So, we are live on the YouTube. We wait for a minute or two for others to join and then we'll start.
Sure, sure.
Okay. Good morning. How are you?
Good morning.
Good.
Okay, so here we go. Good morning, friends. Welcome back to Saturday Club of Baroda morning meeting. And today we have Dr. Samir, contractor, with us. He is not new to Saturday Club of Baroda. Even when we were running it offline, we had him as a guest speaker several times. And after starting this online meetings for last 3.5 years, this is the fourth time that we have been fortunate enough to have Dr. Samir, contractor. He is going to talk about a very interesting topic, and that is unraveling the complex connection, insulin resistance, obesity, and chronic non-communicable diseases. Dr. Samir, contractor, is a surgeon, has MS, FRCS, Edinburgh, FAMS, and FSCS from USA. He's a consultant laparoscopic and bariatric surgeon in Vadodara. He's PN1 certified nutrition and exercise coach. He is a national faculty for his areas of interest like obesity and non-surgical management of obesity and weight loss. He did his MBBS and MS from Baroda Medical College and got his fellowship in minimal access surgery from Sir Gangaram Hospital, New Delhi. With this brief introduction, I request Dr. Samir to start his talk on this insulin resistance for about 40 minutes or so, and we will have 10-15 minutes of discussion following your talk. So over to Samir. Thank you.
Yeah. Good morning. Thank you, Satish Bhai, for the introduction. I'll just share the screen. So can you see the screen now?
Yes, but not the slide. So
Okay. Now?
Yes, yes, we can see it well.
Okay. Okay. So, good morning, everyone. And I'm very fortunate enough to talk to Saturday Club and all interested faculty, all seniors from Baroda, from different kinds of fields, and it's a delight to talk to such a crowd. So, as always, I have been talking on unusual topics for a surgeon. To talk on such topics is a bit awkward, but that's my area of interest, and um, it's of course it's connected to our health and of course to my practice as well. So I will try and simplify this concept of insulin resistance and its connection with chronic non-communicable diseases, which includes, of course, obesity, diabetes, blood pressure, and cardiovascular disease. So, so we all carry this burden of finding the truth throughout our life, and especially when some of us or our family members are suffering from various kind of non-communicable diseases. And it's even though we are qualified doctors, sometimes it becomes difficult to understand what are the true facts and weigh the pros and cons of the truth connected to a particular concept. So what I will do is I'll try and answer those questions in a most simplified manner as possible. So if you see the list of non-communicable diseases, we don't have accurate statistics of India yet, but I'm just referring it to US, and in India now, since we are following a Western lifestyle for more than a decade now, more than 2 decades actually. So we have a similar group of diseases that are happening in India. Of course, the percentage might vary, but overall health of the population is declining. Diabetes is at the core of all these problems, and more than 60% of the urban population is suffering from either pre-diabetes or diabetes or some form of metabolic abnormality, and which is connected to various kinds of non-communicable diseases like heart disease, cancer, stroke, Alzheimer's. Alzheimer's is also known as type 3 diabetes, and of course chronic kidney disease. So what these are the pillars of our metabolic health. The five main pillars are waist circumference, glucose levels, triglyceride levels, HDL, and of course your blood pressure. But I would like to add one major pillar which has been ignored for a while, and which needs some due importance to be mentioned in our metabolic health, is micronutrient deficiency. It's one of the most ignored aspect of our biology, and it's very, 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 very important in normal functioning of the body. And most of us have been detected as, if you measure clinically in a group of patients, they have some form of major vitamins or mineral deficiency like iron, folic acid, B12 or D3. And since we are not able to measure the other deficiencies, we have to assume if the major deficiencies are there, then minor deficiencies would be there. And if there is any abnormality in this uh, five parameters of metabolic health, if you have more than two, then you are labeled as having metabolic syndrome or insulin resistance syndrome, right? Which is obesity, hyperglycemia, high triglycerides, a low HDL, and high BP. And 88% of US adults are metabolically unhealthy. And I assume that uh, India might be somewhere near that figure. But the most important thing that I need to highlight is there is absolutely no mention of LDL in when we discuss metabolic syndrome. we usually talk about high triglycerides and low HDL. There is a reason for it. So metabolic syndrome is also known as insulin resistance. So we have to know what we are talking about and why this insulin resistance is creating a havoc in our body, how it is doing it, and what can we do about it. So all insulin resistance is not bad, right? Some insulin resistance leads to growth in the body, but if it goes haywire and out of control, and it keeps on increasing in your body and spreads across the tissues in the body, then it leads to all kinds of diseases of modern civilization. So this is, if you have all this disease, then it is a pathological insulin resistance. And if the insulin resistance leads to growth, then it is physiological insulin resistance, right? So the one which is leading to growth is known as physiological. The other is pathological. Physiological, of course, helps the body. So there are two instances in life. But let's first look at what are the causes of insulin resistance. Pathological insulin resistance, basically it's hyperinsulinemia, stress and inflammation, and physiological it's hyperinsulinemia and growth hormone. But here you see the common thing is hyperinsulinemia. So it's of the most important aspect of developing insulin resistance. Until unless you have high insulin levels in your blood, and which is there persistently over a period of years, then and then only you can develop insulin resistance. And there are two instances in our life where we have developed physiological insulin resistance. So that is during puberty and pregnancy. So both are conditions, both states of physiology are basically insulin resistant state, and their sole purpose is growth, right? Some form of growth. And the leading hormones are insulin and growth hormone. So we'll discuss three fundamental points. Insulin, what is insulin resistance, how we develop it, and how we can reverse it. Let's see what is insulin resistance, right? So this is a typical cell with its receptors on the surface of the cell membrane. And when you eat something, especially if it is containing carbs, your blood glucose will go up and it will lead to increased insulin levels in your blood. And the insulin goes and gets attached to its receptors. It unlocks a series of processes which leads to transcription of proteins and activates a chain of reaction of biochemical reactions in the body, which helps to which helps glucose to enter the cells, right? And but there is something which leads to non-responsive receptors that we'll discuss later, of course. That leads to non-responsive receptors on the surface of the cell. And when this happens, the blood glucose will go on increasing because all the chemical processes in the body, in the inside of the cell, they are shut down or either they are decreased in intensity. So this leads to further increase in glucose levels. And when there is hyperglycemia in the blood, it will further increase your insulin levels. So when the cells become non-responsive, the response is hyperglycemia leading to hyperinsulinemia, and this will further try to activate by more and more insulin molecules attaching to each and every receptor on the cell. And this will further try to enhance the biochemical processes to control the blood glucose level and help the glucose enter the tissues. Right. So this is the basic concept of how insulin and glucose works and how insulin resistance develops. So the requirement of insulin resistance is failure of some cells due to some reason that we'll discuss later to respond to insulin, normal levels of insulin. And of course, if there is elevated level of insulin over a sustained period of time, consistently increased levels due to our food, the quality and the content of our food. So let us see on a timeline the glucose levels and insulin levels over a period of many years in our life, right? So over a period of time, gradually the glucose levels increase, right? So there is a time, these are the two, the green is insulin, the yellow is glucose. And if you see these two timelines, before the second line and after the second line, this is the period of insulin resistance when the insulin levels are increased, but you still have a normal glucose level, right? So when you measure now blood glucose level in your routine blood test, and your patients and of course you get yourself checked up, your blood glucose is normal, but we don't normally measure the insulin levels, but consultants have started to measure now. So if you miss this opportunity, which is the window of our opportunity to change and absolutely reverse insulin resistance and not have diabetes type 2 in the next period of this insulin resistance. But if we go beyond this, right? So when the blood glucose is persistently remaining elevated because of our bad diet composition, the pancreas will fail to fulfill the requirement of insulin in response to high glucose levels. And that is when your insulin starts to fall and your blood glucose continues to rise and you develop type 2 diabetes. So in type 2 diabetes, it's basically elevated insulin levels and elevated glucose, right? Here also there is a chance to reduce or reverse your insulin resistance permanently, provided, because when you develop type 2 diabetes, you need more discipline in your diet. When you have insulin resistance, you can just make few changes and avoid being type 2 diabetic in subsequent years. So all this story of insulin resistance begins in fat cells. And when it persists, and if you fail to detect insulin resistance during this period, this is when it starts spreading to pancreas, liver, and muscles. We'll see how it happens. So these are the evidences or references which help you to understand all this concept. I would like to add one more factor here. We saw that hyperinsulinemia, stress, and inflammation are the key for developing of insulin resistance. But there is one other key factor, that is high uric acid level, which most of the doctors now measure as a sign of inflammation, but actually it's in response to inflammation. The uric acid is the most potent natural antioxidant produced by the body in response to high inflammatory state in the body, reflected by the blood CRP levels. So we saw hyperinsulinemia, what it does. Now we see how stress works to cause insulin resistance. So basically, there are two stress hormones. One is cortisol, another is adrenaline. When you have acute stress, you release adrenaline more than the cortisol. But if you sustain this stress over a period of time, if the stress is consistently high throughout the day for many years, your cortisol levels remain absolutely high. And the sole purpose of these two hormones is to increase your blood glucose. We saw in previous slides what increased blood glucose does. So you are taking a wrong diet and your body is stressed because of inflammation, of course, and lots of other stresses in life that we have. Lack of sleep is also stressful to the body. Lack of exercise is also stressful to the body. Overdoing exercise is also very stressful to the body. Of course, there is work stress, family stress, all kinds of social stress as well. So stress of competition. So if this stress is not controlled, it goes out of control, then your cortisol levels will keep increasing your blood glucose. And we saw that this also increases your insulin levels and keeps it high throughout the day. So stress and wrong diet both will contribute to this. Inflammation, basically, it's a release of various kinds of hundreds of cytokines, and what it does is it decreases insulin sensitivity in various tissues of the body, right? The mechanism, we know that this happens, but how exactly it happens is still under investigation. There are few facts that we know, but we don't know for certainty the entire mechanism of how insulin sensitivity goes down, right? And the major stresses are smoking, fat cell hypertrophy, autoimmune diseases, and environmental pollution. So many things we can control, but other things it's difficult for us to control, like environmental pollution. So since it begins in fat cells, let's see what hyperinsulinemia does on your adipose tissue. These are all fat cells. It basically has two mechanisms by which the fat deposition happens, by either hypertrophy, that is the increase in the size of individual cells, or hyperplasia by increasing the number of cells, right? And there is an impact of both this phenomenon in the body. The hypertrophy is bad because there is no further vacancy of fat entering the cells, and it starts to leak, as we see in the subsequent slides. So hypertrophy, if that happens, that is bad. If hyperplasia happens, that is good. And most of these obese patients who have hyperplastic adipose tissue are metabolically healthy. They won't be developing diabetes type 2 or hypertension. They won't have increased risk of heart disease or cancer in spite of being obese. So there is a group of 10 to 20% of patients who are insulin resistant, but and obese, but they don't develop any metabolic abnormalities except obesity. We all know this where hyperplasia happens. The classical example is the insulin injection sites. That's why we keep rotating the insulin injection sites in our diabetic patients, so that this kind of lumps don't form in the body. And these are basically hyperplastic, right? This is classical example of uh, or evidence that proves that insulin leads to fat deposition. So we saw there is no vacancy in hypertrophy, and there is still vacancy of further deposition of fat in hyperplastic adipose cells. So all these hypertrophic cells will soon become insulin resistant, so that body tries to protect itself from further damaging. So the fat cells become insulin resistant, does not allow the fatty acids or glucose to enter the cells. Right? That's a protective mechanism. What it does is it will increase the insulin levels further to allow the metabolic fuel of glucose and fatty acid to enter the adipose tissue. And when it goes beyond capacity, or all the processes go out of control, it starts to leak free fatty acids in the blood. Now let's look at the blood flow in hypertrophy and hyperplasia and why it causes cytokine release. We saw fat release, now we see cytokine release. So in hypertrophy, the somehow the size of the cells, the increase in the size of the cells is not happening simultaneously along with the increase in uh, the number of arterioles that are developing in the adipose tissue. So the angiogenesis does not simultaneously increase, or it does not compensate for the increase in the size of the adipose tissue. But in hyperplastic, the angiogenesis is in sync with the increase in the number of cells. So this tissue of adipose tissue, which is hyperplastic, is oxygen replete, while the hypertrophic tissue soon becomes hypoxic because all the arterioles that are there are insufficient to supply oxygen to various adipose tissues or cells, and this leads to inflammatory changes in the cells and release of cytokines. And this also leads to release of free fatty acids and cytokines. So we saw release of free fatty acids in the blood, free release of cytokines in the blood. This why I'm mentioning this is because this directly affects this various important organs. It affects the entire body, but I've just labeled 6 of them. So in blood vessels, it decreases the blood flow, leading to hypertension. In brain, it leads to Alzheimer's or senile dementia, leads to overall hypometabolism in the body. Kidneys, uric acid retention will ultimately lead to symptoms of gout. In females, a hypoestrogenic state leading to PCOS. In liver, leading to fatty liver and dyslipidemia ultimately, and leading to high triglycerides, low HDL. And of course, in muscles, you start losing muscle. And this is a disease of old age, sarcopenia, difficult to prevent it. This is a state of hypertrophic adipose tissue, which is insulin resistance, and there is no further increase of insulin happening, and it starts to release. There is hyperglycemia, high free fatty acids in the blood, high cytokine levels, so CRP levels are also increased. In response, high uric acid will happen, and this insulin resistance will then the entire phenomenon of this will then be seen in various other tissues, mainly which are of very high metabolic importance are the pancreas, the liver, and the muscle. And this will, of course, lead to an unrelented, uncontrollable progression of diabetes. How do we reverse this insulin resistance? Of course, we should remember the causes of insulin resistance, which is stress, hyperinsulinemia, and inflammation. So for the purpose of this talk, I'll be focusing mainly on hyperinsulinemia. How to deal with stress and inflammation is that's another topic by itself. And why we should discuss hyperinsulinemia, that is because that is the most easily controllable factor. You can easily control it. And this is the most impactful solution that you can have to reduce insulin resistance in the body. How do you lower your insulin? Of course, there are 3 techniques: drugs, diet, and of course, exercise. Diet, drugs, there are various drugs that have been used nowadays. One is metformin, aspirin, of course, helps a little. And the newer group of drugs, GLP-1 analog, that is semaglutide, rampantly used in Western countries. And now patients in India are also taking, but of course they're taking for diabetes rather than obesity. TZDs, SGLT1 and 2 inhibitors, sulfonylureas, and of course insulin. These are the drugs which are used for treating of type 2 diabetes. But remember that lifestyle change are 2 times as powerful and more effective than any of the drugs combined. How does TZD act? It basically, the hypertrophied adipose tissue, there is a transformation, morphological transformation from hypertrophy to hyperplastic. So it becomes more responsive to insulin, and that's how it controls the blood glucose levels. Sulfonylureas and insulin, basically, as we'll come back to this graph, it basically increases your insulin levels. So ideally, sulfonylureas and insulin is not to be used in the early stages of type 2 diabetes because it worsens, right? I don't know why this sulfonylurea group of drugs are still continued for use in patients of type 2 diabetes because the sole purpose of it is to increase insulin levels. So that is worsen insulin resistance in the body, and it will worsen the type 2 diabetes. Of course, it controls the hyperglycemia, but it worsens the pathological processes that are leading to type 2 diabetes. So the diets, Basically, low fat calorie or low calorie diet and low carb diet and intermittent fasting. I won't be covering intermittent fasting today. Low fat, low calorie diet basically is high carbohydrate diet. So remember, if you're taking low fat or low calorie diet, until unless you increase carb, you cannot do low fat, low calorie diet. Any low fat product in the market is absolutely high in carb, right? So because if you see any food, either the only two things which make it palatable is carb and fat. If you reduce one, you have to increase the other. There's no other way, right? Otherwise, you cannot eat that food. Protein is not delicious to eat. It's the taste is not good and it's not palatable. You won't enjoy pure protein. You need some carb or some protein, some fat with it. Mainly, fat is healthier along with protein. The carb is not healthy with protein. But unfortunately, this is the conventional dietary advice being given in medical practice and recommended by various authorities. If we compare the low fat, low calorie diet in terms of the macronutrient composition of our diet, mainly fat, protein, and carb. So we have to see what it does to your insulin levels. So when you have higher fat content in your diet, a low carb diet will have high fat and low fat diet will have high carbohydrate. So you have to figure out what you want to take if you are insulin resistant. From this diagram, it's very clear. From this slide, I'll make it very clear. So if you have high fat, because it has no insulin effect, that's ideal to begin with. If you have high insulin resistance, that is the only way you can reduce your insulin levels by increasing amount of healthy fat in your diet. Protein, of course, it has little insulin effect, but in presence of hyperglycemia, so you should know your glycemic status. If you have hyperglycemia and you take high protein diet, it will further aggravate your insulin resistance because it spikes your insulin if you take high protein diet if you are insulin resistant. And of course, carbs, especially all the refined carbs, sugar, good, honey, fruit juices, cold drinks, all sweets, desserts, everything from refined atta will lead to high insulin level, spike in your blood. And if you take that multiple times in a day, your insulin levels remain high throughout the day. And that's going to be the main contributing factor for developing of insulin resistance. But in 2020, the ADA nutritional guidelines change and reducing overall carbohydrate intake for individuals with diabetes has demonstrated the most evidence for improving glycemia. So now in 2020, they accepted that low carb diet is the mainstay of control of glycemia of the patient. And that is the only diet which has been studied most adequately and as having maximum evidence to support it. So let me simplify this thing for you. So I've devised one simple single page dietary solution for all my patients. Of course, this is not only for obesity. This is for hyperglycemia. This is for abnormal lipid profile. This is for increased risk of, if you have increased risk of cardiovascular disease, if you have high uric acid levels, if you have autoimmune disease, if you have cancer. So this is a very safe way to eat your diet. And this is what humans are supposed to eat, right? So I've summarized the entire dietary solution on one page for you. So it involves three steps or three main points. One is stopping the wrong food, right? So sugar, good, honey. Of course, it has to go if you are insulin resistant, right? If you have no metabolic problem, you can eat whatever you want. But of course, I won't advise that as well, because ultimately you will need to do this if you develop insulin resistance. So wheat and maida, of course, refined wheat and maida, potato and potato products on a daily basis, refined oils, all refined oils. I say they are the highly inflammatory substance in our diet. The virgin oils are good. Refined oil, none of the refined oils are healthy, right? Whenever the word processed or refined is used on a pack of product, that product is not going to be healthy whatsoever. The health authorities or the companies or doctors or anyone who says that, it's not going to be healthy, right? Refined oil, if you don't want to believe me, just go on Google and study how refined oil is made, and the history of refined oil, how it was introduced in our diet. Refined oils were basically the first few years of refined oil was used in machineries, right? Subsequently, fat fear came, animal fat fear came, and that's an entire story. I have a lecture on that, and so animal fat was reduced and plant fat was introduced. After the introduction of refined oil, that is when the processed food industry began. So it all began in the 1980s. First dietary guidelines of the world came in 1980s. That is when the American government introduced refined oil in our food chain. Rest of the world, of course, followed it. In India, we don't have a studied dietary pattern. We just follow the Western dietary guidelines with some ramifications, some uh, adjustments here and there. So refined oil, the reason why processed food industry and all kinds of various foods that you see around, attractive food types that you see around, is because of presence of refined oil. If this was not introduced in 1980s, we would not be suffering that much. We would not have an epidemic of non-communicable diseases so soon in our life. So those diseases which was supposed to happen in 60s and 70s and 80s, they are happening in 20s, 30s and 40s. So that was stopping. This is starting. So I would advise eating bajra or jowar one a day if you are insulin resistant, right? If you are not suffering from any metabolic diseases, then you can eat whatever. But somehow I have a strong belief and understanding. I've gone through multiple literatures and read many books also. And I was also myself suffering from gluten. So I just stopped wheat and maida, and that made almost 20-30% change in my health. So all milk products are good, except drinking milk. So don't drink milk, but have all the milk products, right? So lactose in the milk is not good. It's inflammatory. If you're even slightly intolerant to lactose, you might be not be allergic to or full-blown intolerance, but if you have mild intolerance, then also your body undergoes inflammation. So any food substance, if there is intolerance in the body, and if you continue to take that substance, it will cause havoc in the body, ultimately leads to autoimmune disease. And contributes, not leads to, but contributes to autoimmune disease. Eggs with yolk, all non-veg is fine if it is cooked in a healthy way. All seafood is fine. Coconut is healthy. And I personally advise and I personally follow the cooking medium should be ghee, butter, or virgin oils like olive oil, coconut, and peanut. Olive oil, of course, I want to briefly point it out here that it's not used for high temperature cooking. Should not. But virgin coconut and peanut oils, you can use even virgin palm oils. Palm kernel oil is the word virgin is very important. So it should be cold pressed rather than refined. And that will lead to minimum inflammation in the body. So I've answered these three questions. If you have any further questions, then I would like to answer those questions as if you have any doubts, I can answer those questions for you. So Satish bhai, thank you.
Yes.
And thank you everyone for a patient hearing. I was short and sweet this time. Normally I cross my time.
Thank you, Dr. Samir, for a wonderful presentation as usual. No provoking lot of thoughts and some discussion also. Can you please stop the screen sharing so
Yeah,
that
yeah, I'll just do that.
yes.
Okay.
So to start with, my own queries regarding coconut oil. We read a lot of things about coconut oil. If consumed in excess has some disadvantages over other oils. Is it true?
So if you see the basic process of cooking, and most of the Indian cooking is at an extremely high temperature, especially our Gujarati cooking.
Hmm.
So Gujarati cooking, when you cook any thing in at high temperature
Hmm.
in a highly unsaturated oil, then there are chances of forming of trans fats. So what happens is when you cook any unsaturated oil, the double bonds break, right? The double bonds break, and so there are two isomers which are being formed, right? I'm just going back to chemistry a little bit to understand. So there is a cis formation. So when both the hydrogen atoms attaching to the double bond, which is breaking on the same side of the chain of molecule, then it is a cis transformation. But if one molecule goes on one side, the other goes on the other side, that is a transformation of that particular molecule of oil. So when trans fats form, and we all know that trans fats are the leading causes of risk factor for developing of heart disease and inflammation in the body. So coconut oil, palm oil are 90% saturated fat.
Okay.
The saturated fat is the simplest molecule in our body. There is no way you can make it worse because there are no double bonds,
Okay.
right? So for high temperature cooking, ghee, butter, virgin coconut oils, virgin palm oil are very good, but not refined. Refined coconut oil, refined palm oil are dangerous.
Okay.
So don't go for those, right? And majority of, if you go to any restaurant, if you go and see any bakery, there is no bakery in the world, there is no restaurant in the world, there is no farsan shop in the world where you will see they use virgin oil. They will use refined oil because they are cheaper, right? The product that are, if you see anything which is manufactured in a saturated fat, and if you produce the same thing in a unsaturated fat, the shelf life of the product of unsaturated fat cooking is higher than the saturated fat cooking, right? And that is the reason why the food industry uses that. Because if you want to produce something and put it on the shelf and have an expiry date, and as long an expiry date as possible to increase the profitability, you have to use unsaturated fat. And that is why this concept will never be known to general public, right? The food lobby, the food industry lobby will never allow the common man to know this concept. This is pure biochemistry and biology of our body.
Right.
And anything which is cooked in ghee, it gets stale very early. એટલે
Mhm.
પહેલા વાસી વહેલું વહેલું થઈ જાય. And the
Barabar.
same thing you produce in oil. You can keep it for a day or two extra.
Okay. So same is true for repeated frying. I know we often read about
Yes,
being used
that
for
is
repeated
dangerous.
frying. So the
So
same mechanism.
when the bhajiawalas and all these farsan shops, they use oil,
Hmm.
right? They start the gas in the morning and stop it in the evening. So there
Mhm.
is a continuous high temperature cooking in that. Probably some of them might be reusing the same oil partially,
Mhm.
right? And they might be adding some new oil for taste, but they might be using the half of that or 30% or 20%. So you just imagine how much amount of trans fat is there in all this portion that we eat. chevdo, chavano, gatia, sev, mamra, khakra, bhajia, samosa, right? All this is killing.
Mhm.
This is the food which kills. You cannot have it every day in your life. You have it on your festival days. You have it on your holidays. When you go on a trip, you enjoy. You enjoy your celebrations like a marriage function in your house, not your friend's house or your relative's house. You cannot enjoy every relative's celebration, right? So you can't cheat on those days, but you cheat on your days. That is your birthday, your anniversary, your festivals. So there are 4, 5 Gujarati people enjoy 4, 5 different festivals. So enjoy 3 days, 4 days in Diwali, Uttarayan, couple of days, Raksha Bandhan, Duleti, Holi, New Year, Christmas. So there are 10 days in a year where you can cheat in whatever food you want. But you cannot bring this food kind of processed food that I mentioned in your house and store it. Dabba na bharai, basically.
Barabar. So what
It's
about conferences? I am in Kochi attending conference for 4 days. They are also
uh,
cheat days, I believe.
so
But
there
fortunately,
you have
this
a
hotel
choice there.
serves us a ragi idli, no? This hotel is serving us ragi idli,
Yes, that is
which
good.
will fit into your concept.
Yeah. So you, idli sambar is good. See, sambar, this hotels, they cook in coconut oil. So you can have idli and chutney or dosa and chutney. That is good.
We
You
have a
can have omelette.
question. We have a question from Dr. Gopal Agarwal. How about
Yeah.
cold pressed sunflower oil and about rice?
So cold pressed sunflower oil is still good. But why I mentioned coconut and palm oil only is because they have higher saturated fat content, right? And some of you might think that why I'm talking like that is, and of course, there is of course an evidence that high free fatty acid levels in the blood leads to inflammation and leads to insulin resistance, and it increases the risk of heart disease. But there is an evidence that this fatty acid that is there in the blood is not from diet, because dietary fat remains very transiently in the blood.
Mhm.
Only till the it is distributed in your after diet intake for a couple of hours, it will then be distributed to various tissues in the body, because fat is absolute requirement for each and every cell health, health of each and every cell of the body. Because our cell membranes, if you see, is basically composed of saturated fat, little amount of unsaturated fat, mainly saturated fat, cholesterol, and polyunsaturated fat. There is a little contribution from that. So we need all kinds of fat, but you should not restrict. We should not be worrying if we are eating natural fats,
Okay.
right? So any cold pressed oil is a natural fat, right? And
What
if you
about the
have
rice?
so rice, of course, you can eat small quantities of rice. You cannot have like khichdi as your main diet on a daily or alternate day basis. Khichdi is pure rice, right? It's pure refined carb.
Right.
Rice and dal, khichdi is.
Hmm. Uh, yeah, rice
So
and
there
dal
is
to
a
dal to
protein
uchi
also.
लागेल.
Protein
Khichdi
part is
ka
there.
rice and dosa hoite. And see, we can't eat absolute. We cannot have a high carb diet content
Yeah.
on a daily basis. તમે ખીચડી ખાઓ. See, it can be part of your diet. It should not be your diet. Or it should not be food on your plate.
Yeah.
કે તમે ખીચડી 80% ખીચડી ખાઓ છો, 20% બીજું ખાઓ છો. તમે 80% બીજું ખાઓ, ખીચડી 20% જ હોવી જોઈએ. So you eat some protein, some fat, and all those people on this, in this audience, a word of advice is, as we grow older, our protein intake or protein requirement doubles. So if your protein requirement is 1 gram per kg body weight at 40 years of age, when you reach 60s and 70s, it becomes 2 grams per kg body weight, right? So majority of us, if you are vegetarians, you will not be able to take. And if you eat doodh and bhakri and khichdi, then you are further deteriorating your protein intake.
I have two questions.
Hmm.
Glycemic index, what is its relation to insulin resistance and snacking, intermittent snacking?
That will cause
So-
insulin resistance.
So I'll tell you the origin of snacking. It came after the only introduction of refined oils. Snacking was a word introduced by food industry experts, and the dietitians, nutritionists in America who are, supported and financed by this food industry people. They brought in snacking. Why should one snack? Before 1980s, there was no terminology as snack. People used to eat 2 meals a day because majority of them, that's what they could afford, right? And that's what people, they were hungry 2 times a day. There was no need for eating multiple times a day. So if you don't eat fat and protein in your main meal, you are going to be hungry after 3 hours. So you will snack. So every time you put food in your mouth, especially if it is refined carb, it's going to spike your insulin, right? And higher the insulin goes, the higher the chances of other insulin resistance and your risk of other diseases, right? So your mental health gets affected. So Alzheimer's, which was probably unknown before 1980s, now it's commonly happening even in 50s and 60s, especially because now statin has been there in our pharmacopoeia of humans, that majority have been taking statins now for more than 10 or 20 years. And statin will further deteriorate mental health. Because if you go on WHO website, if you go on a WHO website, you will see the graph of all the countries put together. And it's a mortality chart. And it's very interesting. Higher the cholesterol, right? Higher the cholesterol, the lower the overall mortality from all causes. Lower the mortality from cardiovascular disease in old age. And there is an interesting chart there on WHO website. After the age of 50, women should not lower their cholesterol. So higher the cholesterol is more important in a woman than men to control cholesterol. So higher the cholesterol in women after the 50 years of age, better your hormonal profile will be, because all the sex hormones are, the raw material is cholesterol. So don't try and reduce that. And higher the cholesterol levels in women, the better the quality of life, the better, the lower the overall mortality from all causes. This is there on WHO website.
So,
Right?
Dr.
And it's-
Samir, I would suggest that please put those references in our group so that we
Sure,
can.
I'll share all the
This
graphs.
is a very controversial subject, as I know. I discussed with my physician friends.
So there is no controversy actually, sir. But
Okay.
the controversy has been created by our mainstream teaching,
Okay.
right? Our guidelines don't allow us to understand all this truth. But if one needs to understand that we have to go and study our physiology and biochemistry, understand how the body functions. Whatever I've said, nothing is new actually. It's pure sheer biochemistry, which I revisited, and pure physiology, how the body works. And when we correlate, because never ever I studied in MBBS, first MBBS, I read the textbook again, right, to understand. Then cholesterol is not bad. It is only high triglycerides which is bad. So in your lipid profile, if you have high triglycerides, then there is a serious problem in your body.
Okay.
And you saw that metabolic syndrome,
Hmm.
there is no mention of LDL there,
Right.
right? There's only mention of two things. If you have low HDL, if you have high triglycerides, and that is your abnormal lipid profile. If you have this two combination, then statins are not going to work, even if you take it,
So
right?
that's the reason, I mean, in your slide, you showed egg with yellow and white both. I mean, you
Yes.
advocate to take the yellow
So
part of.
how do you reduce your triglyceride? If you have 1,000 triglyceride level, you want to reduce it to below 200. It's very easy, and you can prove it by yourself. There is no need for you to believe anything. If you have high triglycerides, so if you have more than 300, 400, 500, or more, if you have 1,000 triglycerides, just cut down on sugar, good honey, wheat, and maida. લોટ વાળી વસ્તુ બંધ કરી દો, કાં તો ઓછી કરી દો. So you just eat one roti a day. That's it. Not one roti in each meal. One roti a day, right? And cut down. If you're eating roti, don't eat rice. If you're eating rice, don't eat roti. અને રાઈસ ખાઓ તો એક આપણી નાની વાડકી આવે છે એટલો જ રાઈસ. બાકીનું પેટ ભરવાનું છે આપણે શાક, કઠોળ, દાળ, પનીર, eggs. If you're eating eggs, if you're eating non-veg, you eat non-veg. So fill your tummy with protein and fat. Don't fill your tummy with carbs. ચાર રોટલી ખાઈને આટલું શાક ના ખવાય, right? શાક આટલું ખાઓ ને રોટલી એક જ ખાઓ. That is my advice. And do that for 2 months, right? Of course, no sugar and no fruits. If you have high triglycerides, if you have type 2 diabetes, why I don't understand why there is no recommendation to stop fruit, sorry. Fruit is highly insulin resistant food, right? So it basically leads to if once you eat fruit, because some of the fruits are labeled as low glycemic, right? And that is why that mainstream doctors don't advise to reduce or control fruits. But what happens is it does not spike your blood glucose suddenly, but after 3 or 4 hours, when the fructose gets converted to glucose, that spikes, because fructose does not require insulin to enter the hepatic tissue, right? And fructose does not enter any other tissue in the body. The only tissue that allows entry of fructose inside the cell is hepatocytes, and
Liver.
that is why it only liver tissue can metabolize fructose, and that is why it is so bad. So what happens if you take excess fructose in your diet, right? એટલે તમારું sugar છે, table sugar content, તમારા બધા નાસ્તા જેટલા બી તમે ચેવડો, ચવાણું, ગાંઠિયા, સેવ, મમરા, એ બધું તમે ખાઓ છો, એ છે બધી good, excess good. So if you take excess carb, that gets converted. Basically, it gets fermented in the body. The same thing that is there in wine industry, production of alcohol. So what it does is forms ethyl alcohol, and it gets immediately converted into acetaldehyde.
ગેસ બંધ કરે છે
Right?
ગેસ બંધ કરે
It gets alcohol gets oxidized to aldehyde, and aldehyde gets oxidized to acid. So it increases your citric acid level. If you increase your citric acid level, now you need to understand why I'm talking about biochemistry. If high citric acid levels, it will increase the manufacturing of triglycerides, right? So the formation of triglycerides. So high triglyceride, high VLDL manufacturing in the liver to transport this triglyceride to the peripheral tissues. So ultimately, this will lead to your increase in LDL. Because VLDL, when it degenerates into a smaller molecule, when it offloads its triglyceride and cholesterol to the tissues, it forms intermediate density lipoprotein and low density lipoprotein. So if you
Samir,
want to reduce carbs.
okay, Samir got the point. Now there are two questions, so please rapid fire quick answers. Can certain exercise help switch fat from hypertrophic to hyperplastic type? Another is regarding hereditary, role of hereditary. Yeah, please answer.
Yes. Probably it helps in improving, definitely. There is no definite evidence, but there are certain anecdotal studies which helps to understand how exercise improves your insulin sensitivity. So this biological transformation or morphological transformation from hypertrophic to hyperplastic has not been studied. At least I have not come across such a study, and I would like to know if somebody comes across and shares in the group. I would like to go through it, and but it definitely helps to improve your insulin sensitivity of your body. And one should do a routine exercises, but there's no need to go to gym. So just do your routine work on your own as far as possible. Just imagine there is no domestic help in the house like we are staying in US. Do everything on your own as far as possible, and climb stairs wherever you can. Of course, if you're old age, be careful, but you can climb them slowly, right? If એક માળ બે માળ હોય તો ધીરે ધીરે ચડો તમે, because the main problem in old age is sarcopenia, right? So as I mentioned, if you are having insulin resistance, and most of us are now developing insulin resistance, so you have to measure it by doing your fasting insulin and postprandial or post glucose insulin levels, uh, available in now various labs. So you can get this. And if you want to know that there is increased production of triglycerides in your blood, free fatty acids in your blood, then you can measure also 16 palmitoleic acid in your blood, which proves that what happens to excess high carbohydrate diet in your blood. Is there any de novo lipogenesis happening in the blood, right, in your body? Because most of the free fatty acids that are there in our blood, whenever you measure, even in fasting, this comes from de novo lipogenesis. Some of it comes from mobilization of fat during fasting, but uh, majority of it comes after the meals is from palmitoleic acid, which is, and what fat the body manufactures livers is palmitoleic acid, and which
Samir,
is a saturated fat.
we have to wind up now. It's already 7 minutes,
Yeah.
5
What
minutes
was
past
the
9.
second question?
So, yeah, there was regarding, no, can we do anything about hereditary, hyperlipidemia? Or
Uh, if you have proven hereditary hyperlipidemia, we you need your basically your profile needs to be studied properly. What exactly is the reason why you're in? Because there are 5 different types of hereditary hyperlipidemia.
Mhm.
So
And other
each
question
has got the different survival profile.
right. Other was regarding insulin measurements frequency, how often you measure. I think you
Measure
also
it once,
replied about
then
insulin.
make a significant change in your life, and then repeat it after 3 months or 6 months.
Okay, okay,
But
okay.
until unless you change your lifestyle, the way
Mm.
you eat, the way you
Mhm.
sleep, there's no point in going on repeating the test.
So thank you so much, Dr. Samir, for wonderful talk and a lot
Thank
of
you. Thank you.
interactions following your talk, and it reflects
We can have
Yeah,
separate
we
you
can
are.
continue question and answer on the group.
Yeah, in the group also, for a couple of days, we'll allow those interactions on the group. And
Yeah,
of course, you are always there to, you are my go-to man whenever I have difficulty in finding a good speaker. So thank you so much, Samir,
you're
and
most welcome.
continue to take your help in future. Thank you all for
Sure.
joining. We meet next Saturday again. Thank you all. Thank you. We end
Okay.
the session.
Thank you. Thank you, everyone.